Female genital mutilation or female cutting in the old terminology used to be called circumcision, and that really didn't do it justice. There's different degrees of it. Sometimes they take the top portion of the clitoris, the skin, and that was the one that was called the circumcision. But most of them are much more violent than that and much more aggressive, where the labia minora, the parts of the outside skin of the vagina are cut. Sometimes the labia majora, the bigger parts of the labia are cut. The clitoris is cut, and then they're sewed together. And sometimes using wire. They can use anything like razor blades or other sharp objects. And often it's quite disfiguring and it's quite traumatic. The main reason often that's cited is that the women, if they have a clitoris in place, they are more promiscuous. So often the elder women tell stories that if they are not done, the women, the young teenagers, will be going around having sex with lots of boys, and they're trying to avoid that. The labia are usually sewed together in the worst scenarios, and what happens then is that they leave a little tiny spot, a space that is about 5 millimeters or so, so that the woman actually urinates behind this membrane that's there into the vagina and then dribbles out of the vagina. And they actually can't have sex. And even when they get married, there's many cases that we see them in Canada where the husband has to ejaculate outside and then digitally with his finger push the sperm into the vagina, hoping that that's going to work and they can get pregnant. In fact, one of the issues we had many years ago is that some of the population from some of the Eastern African countries that comes to Canada, they have a baby during labor. You're correct in the sense that they're having a difficulty having a baby. The baby can get obstructed, and we need to open up the vagina so that they can actually pass the baby. And the husbands often wanted us to sew them up. And that's been, we have advisement from our national society that that's unethical, so we cannot redo genital mutilation. We can't mutilate them again. I do have patients who are Canadian who were then sent under the pretense of going to visit their family, and at age 12, 13, so this is a Canadian young girl who was then forcefully had the genital mutilation done. And there's one instance I can think of, and she was quite upset about it. It really is a sexual assault. So she was assaulted while she was there against her wish, without her parents being there, by her extended family members. And that was the wish of the parents, Canadian parents, who did that to her.